Okay, perfect. All right, well, we'll go ahead and get started. I have a lot to discuss. As I told Assisi, I'm sure that all of you are out there worried, as am I, about post-COVID separation anxiety. So that's what we're going to talk about today, and specifically in dogs, but I'm going to talk a little bit about cats, who are kind of the unsung heroes, so to speak, of separation anxiety. All right, so obviously COVID-19 has had the majority of us in some way, shape, or form working from home. My own clinic took about 2 months of doing telemedicine, and then thankfully we were able to go back in the office. But my pets, I know, and my children were quite traumatized by the whole experience of everyone being at home. So I know that a lot of our dogs and cat patients are going to have the same issues once their owners go back to work. So what we're going to talk about today, we're going to talk about overt separation anxiety, what you guys are most often likely thinking when we say the term separation anxiety, cases of mistaken separation anxiety, covert separation anxiety. How do we diagnose these disorders? What is hyperattachment and how is that different from separation anxiety? What is confinement anxiety and how is that different from separation anxiety? And then the comorbidities that go along with separation anxiety, and then how do we treat this disorder? So overt separation anxiety, again, probably exactly what you guys are thinking of when you think of the term separation anxiety. It's the obvious one. So the owners come home and there's either urination, defecation, destruction, or there's a note on their door that their dog, the neighbors are complaining because the dog has been vocalizing the entire day. They may get an exuberant greeting upon return. So the dog is, so over the top excited. And oftentimes these dogs are known to be kind of Velcro dogs. So they're the ones that are kind of attached to your hips. So if you get up from the couch to go to the bathroom or to get a drink of water, they're right there with you. So let me talk to you about little Charlie Champion. He is one of my absolute favorite cases from back in my residency. And he was a little 8-pound Dachshund mix, and little Charlie Champion, that is his full name, by the way, you must call him that. He had very overt separation anxiety. So one day in the life of Charlie Champion, this is his crate, and this is actually a large dog crate. So it's a pretty heavy gauge steel wire that he escaped from. And let's look at the havoc that little Charlie Champion wreaked in that one particular day. So this is literally one day. This is a picture frame up in the upper left-hand corner. Thankfully, the glass was not broken, but he had destroyed all the cardboard and the frame itself. This is a phone charger. This is the carpet padding underneath the carpet that leads into their kitchen. There's some books and papers down here in the bottom left and a towel from the bathroom. These are some of the books and papers that the owners had left on their dining room table that he had destroyed. And then this in the bottom right-hand corner is the big heavy speaker. And so I can only assume that Charlie tried to jump on top of it. So that is one day in the life of little Charlie Champion. Now, the unfortunate part about Charlie, this particular day, so if we go back to this slide, you can see how he got out. Typically, what he would actually do is he would take the crate and he would push as hard as he could on the side, which would then topple the crate over. So then it was laying on its side. The bottom crate pan would then kind of fall on top of him. He would then climb out on top of the crate pan. And as if you have a wire crate at home, the openings in the bottom are often much bigger. And so then he would just squeeze out the bottom. However, on this particular day, the owners had sort of wedged the crate into a corner, so he couldn't actually do the typical escape route. So he took matters into his own hands, and I do believe that he actually ruined a canine tooth in the process in this day too. So that's pretty obvious. But then we also have cases of mistaken separation anxiety. So mistaken separation anxiety, the complaints may be exactly the same. We may have a dog that when the owners come home, they see urination, defecation, destruction, vocalization. They may have a very over-the-top greeting from the dog when they come home, and that dog may in fact truly be a Velcro dog. But the reason that's mistaken is it's not actually separation anxiety. So we'll talk about that. That one particular case that this picture is taken from in just a second, but some of our differential diagnoses for what else could be happening when we come home to urination, defecation, destruction, and vocalization Urination could be incomplete house training. There could be other phobias if the dog has storm phobias and it happened to storm that day, or there's a noise phobia and the apartment fire alarms went off. Could certainly be medical in nature. So we could have a urinary tract infection, or the dog could be PUPD and not be able to hold it for as long. With defecation, same thing, incomplete house training, other phobias, and medical disorders like parasitism, inflammatory bowel syndrome. Destruction, it could just be a lack of environmental enrichment. I had nothing to play with, and so I took matters into my own hands and destroyed the couch pillows. Vocalization could also be other phobias. There could be medical. The dog could be vocalizing because it's painful. And then you can have an exuberant greeting upon owner return and a Velcro dog with what we term hyperattachment syndrome, which we'll talk about in a sec. Now, some owners will say, but he looks guilty when I return home, so I know he has done this. He's done it on purpose. He did it to spite me. He's mad at me. Well, what you're actually seeing are what are known as appeasement gestures. So this is not guilt in a dog. We actually don't think that dogs have the capability to have that very human emotion of being guilty, because they're so in the moment that once things happen, they're over it 2 to 3 seconds later. But what you're seeing on the left hand of the slide is what we call the ladder of aggression. And this is in the BSABA Canine and Feline Behavioral Manual, if you're interested in getting a copy of this. But those green, yellow, and orange signals are all things that a dog would do to communicate that, you know what, you're kind of worrying me, please back away. Please don't make me escalate. And so that's why we call it the ladder of aggression, because if those nonverbal signals are not heeded, then you may have to escalate to accomplish your goal of controlling a very scary situation. So like for this dog, he's being pointed at, and you can see he's got what we call the whale eye, where you see a lot of the whites of the eyes, those ears are pinned back. I suspect if you could see those pupils, they are incredibly dilated. He is trying to stay as far away from that owner as possible. If this were a real-time video, I suspect he'd probably be licking his lips and blinking his eyes very rapidly. So these are just appeasement gestures to say, look, I don't know why you're upset, but you're kind of worrying me, so please stop what you're doing. So it's not him saying, oops, I peed on the floor, I'm so sorry. So this is a case of mistaken separation anxiety. This is actually another Charlie case. It was an 8-month-old male, neutered male, Roddy mix that came to me for what the owners were complaining was separation anxiety. And this is one particular day. That is the phone book. So you can tell how old this photo is. I don't think we even get phone books nowadays, but that's the phone book torn to shreds. And what we found out with this dog is that actually this was just a lack of environmental enrichment. This was a young, exuberant, 8-month-old ratty large breed dog that didn't have enough exercise, didn't have enough, mental stimulation in the form of feeder toys, training, that kind of thing. And he would just take matters into his own hands. So the way that we found out, we will talk about in a second on how we determine whether it's mistaken anxiety, separation anxiety, or overt. So let's talk a little bit about covert separation anxiety. These cases are a little bit more insidious because oftentimes owners don't necessarily notice some of the big signs. So the chief complaints, the dog may not eat when they're home alone. We do know that anxiety suppresses appetite. And so if the owner says, well, I usually put out breakfast, but they generally don't eat until dinner time, I'm thinking that dog may have separation anxiety because it's worried all day. It can't relax enough to eat, but then once mom and dad come home from work, then everything is normal and then they go back to eating. They may have excessive thirst upon the owner's return, and that's because they've been panting and pacing and maybe vocalizing all day. There may be some destroyed bedding. So oftentimes, especially in a dog that's crated, I will ask the owners, well, do you leave a bed for the dog in the crate? And they'll say, oh, no, he destroys everything we put in there. Well, this is a 4 or 5-year-old dog. So that's an age beyond which destruction is normal. You shouldn't want to tear up your comfy bed that you get to lay on. And so that is most likely an issue of anxiety. They may attempt to block the owner's departure. And so we have some dogs that present to us actually for aggression towards the owners. One just last week, they came in because the dog was aggressive towards their feet when they would put their shoes on. And it was because the dog had separation anxiety, and it was trying to basically just displace their frustration and their anger and their anxiety on the, the feet, because the owners are putting their shoes on to actually leave. So other behavioral disorders may worsen on days of departures, and we'll talk about what trigger stacking is. So obviously no overt signs of, destroying the couch, pooping and peeing everywhere, neighbor complaints of vocalization. So let's talk about what trigger stacking is. So every behavior has a threshold. So above which we see the behavior and below which we don't. So we all start out at baseline at any one point in time, and then things can stack. Our little triggers can stack us and push us over threshold. Now, depending on the amount of stress that particular trigger causes you, it could immediately push you over threshold, or it could be a cumulative effect. So for some of our separation anxiety dogs, we could actually trigger stack throughout the week. So Monday, they're at baseline because they've been with their owner all week. Tuesday, they're getting a little worried. Wednesday, you keep leaving me. Friday happens, you've left me 5 days in a row. And then, oh my God, now you want to have a Friday night dinner party. And I'm already a little bit stranger danger, aggressive with some fear-based aggression towards strangers. Forget it. You are not going to be able to have anybody over for dinner on a Friday night. Now, had you done that on a Monday night, we may not have seen that same reaction. The other things that we can see in terms of trigger stacking are every little other behavioral disorder and medical. So maybe the dog has separation anxiety, but it's covert, it's very mild. Also has some fear of strangers, and the super had to come into the building for the day and, fix the dishwasher, and the dog was crated during that. Noise phobia was happening. So let's say either there was construction down the road, or, the super with all his tools was making a ton of noise and trying to fix the dishwasher. The dog is also limping and has been since they went to the dog park, last weekend, but they just thought they would keep an eye on it because it wasn't terrible. But it's in some mild amount of pain. And then they come home from work and the owners have to leave immediately to go out to dinner. And now we've got, again, another departure for that day. So we've got almost like 2 days of separation anxiety all in a row. And then a thunderstorm happens. Forget it. They're not going to be able to handle it because they are over their threshold. So this is when we're going to see that covert separation anxiety turn into overt separation anxiety. So let's talk a little bit about trigger stacking. This is Lincoln, a 3-year-old male castrated healer mix. That is one of my ongoing separation anxiety cases. And he definitely is kind of the quintessential Monday through Friday trigger stacking case. So Monday, he does great because his owners are pretty much homebodies. They stay home all weekend with him and they go hiking. And so he gets to spend time with his dads. On Tuesday, we're getting a little bit touchy. He's, a little bit more nervous, so it shows some panting on video. On Wednesday, he needs a low dose of his pre-departure medication. And so by Wednesday, he is trigger stacked. And so we have to implement one of those, what we call them PDMs or pre-departure meds. But and then Thursday, he needs mid-range pre-departure medication because he is once again trigger stacked even a little bit more. On Friday, he needs high dose pre-departure medication if they are continuing to leave him for the work week. And then if they try a weekend departure, forget it. So the owners have, thankfully, they are rather introverted and rather dedicated to Lincoln. And so they do typically spend their whole weekends at home because there is not a pre-departure medication protocol that we have been able to figure out for Lincoln that actually works for a weekend departure. So what about cats? So cats, again, are kind of the insidious, very covert separation anxiety ones because typically they're not destroying your house. But cats absolutely can have separation anxiety. And the chief complaints that we oftentimes hear from owners, the number one is urination outside of the litter box when they're left home alone. They are so stressed that they can't even do their normal litter box habits. Sometimes we'll see defecation outside of the litter box, but that is more rare. Sometimes some destruction and sometimes some vocalization. But again, it is a very rare complaint, and part of which is because I think it's unrecognized as a contribution to feline inappropriate elimination. So while the owners may be presenting for urination outside of the litter box, when in actuality, it's actually separation anxiety causing the urination outside the litter box. Oops, so let me talk just real quick about, never mind, I do this later, hang on. Sorry, I always forget the order of my slides when I'm doing these, so I try and get ahead of myself. In terms of diagnosing separation anxiety, the first thing obviously is the presenting complaint from the owner. So they're gonna come to you for some of these signs. The first thing that we always wanna do with a new behavior is rule out medical. A brand new behavior is medical until proven otherwise. And you will hear me say this if you've ever heard any of my other lectures. That's why veterinary behaviorists are so important to the field, because this isn't necessarily always a training issue. So we need to rule out our medical with a good physical exam, a CBC, chemistry, and urinalysis. And we also need to screen for other behavioral disorders. So we talked about all that trigger stacking that can happen, and we'll talk about comorbidities in a bit. But you know, if the dog also has storm phobia, we need to be worried that on days when the dog is left home alone and it's going to storm, that could potentially worsen their separation anxiety and their manifestation of those anxiety disorders. But a definitive diagnosis when it comes to separation anxiety is done by video. And thankfully nowadays we have so many options to do this, but I recommend that owners video their pet during a routine departure, meaning a Monday through Friday workday, obviously post-COVID, because now nothing is routine. A non-routine departure, so those departures where they come home from work, get changed, and then go out to dinner or go to a movie. As the week goes on, because again, remember we can trigger stack Monday through Friday, and so what we see on Monday may not be the dog that we get on Friday. And then a departure when it storms or when there's other things going on for their comorbid behavior diagnoses. So in terms of options, again, lots and lots of options. When my mentor, Dr. Horowitz, she would probably kill me for saying this, but she used to say that to diagnose separation anxiety, they would actually put their answering machine, the good tape kind, on memo function, because it actually would record noise. But nowadays, almost everybody has a camera, whether it be a nanny cam, a security cam, they can do FaceTime. I think everybody can Zoom nowadays. So there are tons of recording devices out there. Some people still have old school video cameras. They may have an old phone or just a laptop or computer that they can set up. So for the most part, most everyone can get some way of actually videoing their pet. So let me talk quickly about the case of mistaken identity. This is where I got ahead of myself on the cat slide. I once had a case that came in. It was a dog that had presented for some aggression towards the owners, and some of the aggression was towards that departure. They would try and block the owner. They would try and bite the sleeves of their jacket. There were some other signs like excessive drinking when they would come home. The dog would never eat unless the owners were present, those type of things. So I told the owners to set up a camera and let's see what we find on video. Well, lo and behold, what we found was the dog did not have separation anxiety. Actually, the cat did. The entire 8 hours of the video, the cat yowled the entire time the owner was gone. And so we think actually that yowling, of course, obviously the cat became then my patient as well, and we needed to address that anxiety issue. But we think that the dog was so anxious about the departure because he knew that the cat was about to start screaming for 8 hours. So, so there are definitely cases of mistaken identity. And we've had cases in the past where there are 2 dogs in the household. One that sticks out in particular from my residency, you know, those learning cases always, you always kind of remember those. There was, the owner presented with one dog who they assumed was the dog with separation anxiety, because that dog would look, quote, guilty when they got home and there was urine or feces on the bathroom rug. So they assumed that that's who the dog was. Well, when we had them video, it was actually the other dog that had the separation anxiety. And so the one dog that was looking guilty was just giving those appeasement gestures because the owners would come home very upset that they once again had to clean up poop and pee. So definitely want to make sure that we're treating the correct patient. So let's talk about hyperattachment and how that is different. So hyperattachment can be with or without separation anxiety. These are those true Velcro dogs. They cannot be without you. Everywhere you go, they are right there. You turn around, you almost trip over them. You get up to go to the bathroom, they're going with you. So now some of these dogs with hyperattachment are able to turn that off when the owner actually leaves. And without looking at video, we wouldn't know that. So some of them are like, oh, okay, she's gone. Well, I'm just going to go lay on the couch and sleep until she gets back. And then I'm going to be clingy, right? But if we didn't know that, we're gonna treat incorrectly. And most of our treatment is just focused on, as long as there's no separation anxiety, is just focused on teaching that dog independence. So teaching them they can be in the other room without you. I can close a door and take a shower without you, those types of things. Then there's just confinement anxiety. So again, this can be with or without separation anxiety. So there are some dogs that the whole reason they are anxious is because they are confined. So in a dog's world, in a human's world too, it is fight or flight. And if I can't flee, that can be panic inducing. And so with these dogs, we would not know without just letting them out and letting them loose and monitoring them via video to make sure that we are not seeing other signs of anxiety. So there are some dogs that just letting them out of confinement solves the issue. So in terms of comorbidities, this was a great study by Michelle Bamberger, and there's a great study by Michelle Bamberger looking at signalment factors, comorbidities, and trends and behavior diagnoses. And then this study by Dr. Overall that I have here up on the screen looking at separation anxiety, thunderstorm phobia, and noise phobia alone or in combination. And what both of these studies found is that dogs that had separation anxiety were much more prone to also have thunderstorm and noise phobia, and vice versa. And so if you have a patient that is, coming to you every spring for their trazodone or their Cilio gel for storm season, you're going to want to rule out that separation anxiety isn't a component, because these are most often comorbid diagnoses. And I will tell you anecdotally in my clinical practice, I call it the trifecta. If we have noise phobia, separation anxiety, and car ride anxiety, I tend to see those three as comorbid diagnoses quite commonly. But also pain can increase noise phobia. So this was a very interesting study that just came out, I want to say in 2018, maybe 2019, I don't even know. What year is it? I don't know with COVID. So this looked at noise sensitivities in dogs and if there was an effect with musculoskeletal pain as a component. And what they had was they had 10 cases that had clinical pain and 10 cases, the control cases, that did not have pain. And what they found was the dogs with pain actually had higher levels of noise phobias. They also found that those dogs presented with noise phobias at a later stage, a later age, than dogs with without pain. So typically noise phobias, thunderstorm phobias, traditionally happen anywhere from about 18 months to 3 years of age without any sort of triggering traumatic event. That's generally when they start, we see that onset. But for dogs with pain, actually had onset around 4 years later than our control cases. So if you see a late onset of noise phobia, like a 7 or 8 year old dog, you want to make sure that you're ruling out osteoarthritis pain as a contribution. And this is the case of Gimlet, a little 6-year-old female spayed pug, where pain actually increased her separation anxiety. So Gimlet presented to me, she had previously well-controlled separation anxiety. The owner could leave for about 6 hours with absolutely no medication. And they did what is called pure desensitization training. So they literally did these, what they call training missions, where Gimlet's mom would leave Gimlet and she would progress from leaving for 30 seconds, up to 10 minutes, and then, move on to the point where she was okay for 6 hours. So all they did was desensitization training. They hadn't needed any medication. Now, when she presented to me, the owner had seen a significant recurrence in her separation anxiety. She could not even leave her for about 45 seconds without Gimlet absolutely panicking. And what we found on physical examination is she had an interdigital cyst. We implemented pain management and topical and oral therapy for the cyst, and she was able to return to 1 to 2 hour departures with absolutely no stress. So we didn't even really have to treat the underlying anxiety disorder once we implemented the treatment for her medical concerns. So let's talk about treatment specifically for separation anxiety. We're going to talk about some of our wearables. I'll combine PEMF and a wearable as well. Pheromones, nutraceuticals, probiotics, medication, and training. So the Calmer Canine and SCC University obviously is our sponsor today, but this is the SCC Loop, and I absolutely adore this little picture. This is pulsed electromagnetic field, and so this is basically electromagnetic energy that emits signals to the brain to help calm the anxiety. And so what is happening is the device, the CC loop, similar, but a different energy level than the traditional pain one that you may all be used to using. It emits these TPEMF signals, and they increase production of nitrous oxide. Nitrous oxide inhibits our pro-inflammatory cytokines and increases anti-inflammatory cytokines. Nitrous oxide also induces production of endorphins, serotonin, which is our coping neurotransmitter, and dopamine, which is essentially our pleasure neurotransmitter. And essentially the net effect is reduction in neuroinflammation, rebalancing of an overactive and anxious brain. So this is not done while the animal is being left alone. It's actually done in 2 15-minute sessions per day. So here's a little pitty mix wearing her little CC Calmer Canine. So it can be handheld or used with the convenience vest that she is modeling. The treatments are done again when the owner is home, not when the owner is departing. And the recommendation is to go about 4 to 6 weeks, and that's one treatment course. And then longer or subsequent treatment courses may be needed in some cases. And they have some great videos that I was trying to download yesterday, of course, during the National Verizon outage. But there's some great videos on their website of showing dogs pre and post treatment with the Calmer Canine, and you can see the difference between the anxiety levels when the owners leave the dogs. There's some other wearables out there. The Thunder Shirt, which is specifically designed for thunderstorms, but can be used for other situational phobias. There's the Anxiety Wrap, which is similar in concept, and then the Storm Defender, which is specifically for storms. The concept of these is essentially like swaddling a baby. So if you think about a baby that is nicely, tightly swaddled, they just feel secure. And so some dogs do respond very favorably to these products, others don't. The nice thing is many of these companies offer money-back guarantees, so it's always worth trying these wearables. Then there's the Adaptal pheromone. So this is the maternal appeasing pheromone that mother dogs produce when they're nursing their puppies. This is by Seva, and it comes in 3 different formats here. As you can see, the collar, which is our little gray collar down here, the spray, which you can spray the inside of their crate. You can spray their wearable Thunder Shirt with it, and the diffuser. So you can plug this in their confinement area. And this has been shown to help with many anxiety issues, including separation. And I will say that one of the biggest areas that I find success with is those first couple days when a new puppy comes home and has left the mom in the litter. That sort of panic separation that oftentimes owners complain about, they kept me up all night because they were crying. I love the Adaptal products for that, as well as our traditional separation anxiety. Then there's our nutraceuticals. So there's 2 nutraceuticals that I recommend. The first being Angstine by Virbac. So Angstine contains L-theanine, which L-theanine is an amino acid found in green tea. And so if you've ever heard of, tons of people drink green tea for its anti-anxiety property. This is just the L-theanine, so it's not caffeinated. You don't have to worry about that. It is labeled for both dogs and cats. And so you can see on here, it's a little chew tab. They take it twice a day, every day. But you can also give additional doses. It's incredibly safe to the point where they did the LD50 studies and they had to stop the study because they had absolutely no deaths, I think at 500 times the labeled dosage. So incredibly safe. I've personally had my own pets get into entire boxes. It is incredibly palatable as well. In fact, most cats will take this just like a treat. So, you know, as you know, getting cats to take anything can be near impossible. So the fact that we have a nutraceutical that they will readily take is very nice. And then on the right here, we have Zilkene, which is by Vetiquinol, which is alpha-casozepine. So alpha-casozepine is a protein found in cow's milk, and what it does is it binds to the GABA-A receptor, so that benzodiazepine receptor that Xanax and Valium and that class of medications bind to as well. It is a capsule. As you see from the picture here, you break open the capsule and you sprinkle the powder either into a pill pocket or onto their food. Quite palatable as well. So most cats, if you sprinkle it on their dry food or mix it into a dollop of wet food, they will gobble it right up for the most part. This is a once daily administration, but many of myself and my colleagues will oftentimes do twice daily administration, even at higher doses than the label, as well as additional doses as needed. So perhaps prior to a thunderstorm or prior to separation. This is Calming Care. So this is a probiotic by Purina. I'm sure you can hear my dog, my lovely veterinary behaviorist trained dogs barking in the background. I'm sure we have a delivery. This is Calming Care by Purina. It is a probiotic. So this is Bifidobacterium longum, which is a proprietary bacteria by Purina. And Bifidobacterium longum has been shown to help with anxiety issues in many rodent models, several human studies, and now we have a study in dogs as well that it can actually help with anxiety. So this is a once daily packet, just like their Fortiflora. It's just the Bifidobacterium longum, but it's the same palatint as Fortiflora, so it's pretty tasty. It is currently labeled for dogs, but off-label, I will use it for cats at a half a packet once a day. Incredibly safe too, because it is just a probiotic. So all three of my own dogs take it. Two that you probably heard barking, take it for anxiety. The other one takes it because she would prefer her food with it on it. So I just, you know, use the palatint to my advantage. So that's Calming Care. And then we have medication. So there are 2 FDA-approved medications for dogs with separation anxiety. The first is Clomicalm here on the left, which is a tricyclic antidepressant. Again, it is FDA-approved for dogs with separation anxiety. We use it off-label for a number of disorders in dogs and cats. But being a tricyclic antidepressant, it has serotonergic properties, meaning it increases serotonin as well as norepinephrine, but it can have more side effects than with our traditional SSRIs. So our SSRI that we typically use is our FDA-approved Reconcile, which is the dog brand of Prozac. So it's the same active ingredient, the fluoxetine, but it's formulated in a once daily chewable tablet that is incredibly palatable, as well as easy, number one, because it is palatable, easy to administer. And then also because it is FDA approved, we have the backing of that. And I find it much more bioavailable than the generic human fluoxetine. Not to mention that it comes in 8 milligram increments versus 10 or 20 milligram increments, as does the human product. And so it's much easier to dose, especially when you're talking about small dose increases or a small dog. Then there are pre-departure medication options. So before departure, about an hour, hour and a half, 2 hours before, the dog may also need, or the cat may also need something to take the edge off. So my first go-to tends to be trazodone, and trazodone dose, this is a standard 5 to 10 mg per kg 2 hours prior to departure, and then you could repeat the dose every 8 to 12 hours after for a second departure. And now if we don't see any effect, or we see a paradoxical effect with trazodone, then I'm going to switch to clonidine. But if I have some effect with the trazodone, just not enough, I am then going to layer in the clonidine. So clonidine typically is my next go-to, and you'll see the dose range in plums as 0.01 to 0.05, but I don't generally start that low. To be perfectly honest, by the time they get to me, they most often have tried trazodone and failed it. And so I'm typically using higher doses of clonidine plus all of the other medications that we're talking about. But again, 0.03 to 0.05 mg per kg 2 hours prior, and then every 6 to 8 hours as needed for a second departure. So again, if we don't see effect or we have a paradoxical reaction, we're going to switch. If we are just not there yet, but it has helped in addition to the trazodone, I'm going to layer. So my next order of merit, I guess, is gabapentin. So gabapentin, now this is not the dose that I use. So I put this in here because this is sort of the higher pain control dose of 10 to 20 mg per kg. But I will tell you that I go 20 to 40 mg per kg about 2 hours prior. And this is my go-to dose. The 10 to 20 is my go-to dose in cats. And actually gabapentin is the first one that I reach for in kitty cats. So if I need some sort of pre-veterinary visit pharmaceutical or pre-departure medication, I'm going to reach for gabapentin for our feline patients first. So again, in order of merit here, trazodone, clonidine, and gabapentin. And if we still need a little something, I may add in a benzodiazepine. So our benzodiazepines, true anti-panic medications, the reason that I don't often reach for these first, and I will say as a general practitioner, I did reach for a benzodiazepine a lot of times first. Number one, because we didn't have trazodone, clonidine, and we didn't really know about the anxiolytic properties of gabapentin at the time. I've been out for a long time now. So, but also because I see a lot of paradoxical reactions, especially with alprazolam, and hence why I put lorazepam as my favorite benzodiazepine. But the other reason is because many of my patients are not just being seen for separation anxiety, they're being seen for a lot of aggression disorders as well. And benzodiazepines, of all the class of medications that are going to potentially worsen aggression through the concept of bite disinhibition, it is going to be your benzodiazepines. And so I don't take addition of benzos very lightly, especially when there's aggression. And so you just need to be aware of that factor. And then there's also propranolol. So propranolol, our beta blocker, can actually block the physiologic panic response that the animal is feeling. So I have some patients that, kid you not, are on all of the above. In fact, Lincoln is one of my more complex pre-departure medication dogs, and he has at one point in time been on all 5 of these medications for any one of those departures. Then there's training for separation anxiety. So this is actually called the BOND program. This was developed by my mentor, Debbie Horwitz, in conjunction with Reconcile, who at the time was, I believe, owned by Elanco, but is now owned by PRN. And so the BOND stands for Be Positive. So the first one, focus on positive behaviors, so that we focus on positive reinforcement and encouragement of our desired behaviors, and no reprimanding, punishment, and ignoring. We want to ignore our undesired behaviors. So, and always remember that our dog is not being bad. So I like to say that your dog is not giving you a hard time, he is having a hard time. So he's not doing it out of spite, right? He's not leaving that poop or pee for you because he's mad that you went to work. He's panicked. So make sure that we're being positive. The O is for only rewarding calm behavior. So ignoring the attention seeking, that hyper attachment behavior when they're overly excited. And remember that if we get excited, your dog may also. So our like, I'm so happy to see you, Fluffy, can actually worsen that behavior. So we want to make sure that we look for opportunities to spend positive and relaxed time with our dogs, and always reward them when they are doing good things, like taking themselves out of the room and hanging out somewhere without you. The N is for no more drama. So when you come and go, you want to ignore your dog. So we always tell clients to, about 15-20 minutes before your departure, basically just act like your dog doesn't exist. Don't talk to them, don't look at them, don't make a big deal out of the fact that you're leaving. I know a lot of my clients, especially my single clients, are like, oh, I'm so sorry I have to leave you. They make a big production over the whole thing. We want to make sure that it is calm as possible, and our returns are as calm as possible too. So want to make make sure we, grab our keys and our coat to signal to our dog that they're about to leave, but then, maybe return to a previous activity. Maybe then go brush your teeth or sit down and check some email before you actually leave. You can also give your dog a toy or a treat about 20 to 30 minutes prior to leaving. So making sure that your departure is actually the best part of their day and not the worst part of their day. So give them a stuffed Kong with peanut butter, give them a bully stick, give them a dental chew, whatever. So that way it's your departure is amazing. And then the other thing is developing their independence. So making sure there is that safe place for your dog to be calm when you're gone, teaching them to stay there for increased periods of time when we are home with them. So they don't have to be right on my lap. They can actually be on their dog bed away from me when I'm watching a movie. Then there's sort of the more advanced further training that oftentimes is needing the hand of a veterinary behaviorist or certified separation anxiety trainer to kind of guide the owners through. And the first one is what we call uncoupling departure cues. Uncoupling departure cues means basically creating those cues that traditionally mean to the dog that you're leaving. I grab my keys, I put on my shoes, I put on my coat, and then don't leave, don't go anywhere. Then sit down and work for the rest of the day at home, so that those cues don't mean anything to the dog, so that they aren't trigger stacked by the time you leave for work. They're down here because those cues don't mean anything to them. Now, I will say that these can be very much overdone. Owners oftentimes will look online for advice, or they'll get advice from a friend, and they'll pick up their keys 18 times a day. And actually, you can make the dog worse by doing that. So I recommend doing this uncoupling departure cues no more than 2 to 3 times a week at most, because otherwise you can actually sensitize the animal to those cues and make it worse. Then there's sort of the last step, and these are what we call graduated planned departures. So these are, we actually give the dog a signal that means I am leaving, but it's going to be for a very short time, and we train for longer duration. So that's what those mission trainings were that I talked about with Gimlet. So Gimlet's signal was to be put on her little bed, and that was her signal that mom was leaving. And initially, mom only left for 5 seconds and came back. The important thing is that we want to keep the pet under their threshold at all times, meaning they are calm and relaxed. They are focused on that Kong or that bully stick, not they're already at the door panting, whining, crying, and then we come back. So many of these animals cannot get to the place of the graduated planned departures without a medication protocol that's appropriate for them. And what never works? Punishment. So you coming home and punishing your dog for being bad because they destroyed your couch is not going to help. Now, it may make you feel better, because that's actually what punishment does, is it makes the punisher feel get rewarded for that. However, what it can do is actually increase the anxiety of your dog's anticipation of your return home. And what also never works is get a second dog. So it is not about them having a dog next to them. It is about having their human. And also doing nothing and hoping it'll go away, that's not going to work either. So most often these cases get worse without treatment versus better. So do we wean off medication, or can we? It really is going to depend on the case. So it's going to depend on the severity level, the level of panic, the age of onset of the separation anxiety. Was it some sort of traumatic event that caused it later on? Or was this like the moment the owner got this dog at 8 weeks of age, this dog had, horrible separation anxiety? It's going to depend on how much training they can put in. If they don't have time, like many of my owners here in DC, to put in any of the time for the graduated planned departures, we're unlikely to be able to get off of medication because the learning truly hasn't taken place. And then it's also going to depend on the amount of medication that the dog is on. So Lincoln, our dog that takes 5 at some points during the week pre-departure medications, he's never coming off of meds. Unfortunately, he relies very heavily on the medication for this disorder. But if the owners want to, and if you are on board with this, we recommend going 8 to 12 months of clinical resolution, meaning they are watching the dog or cat on camera and there is no signs of anxiety. And then we will do a slow wean off of one medication at a time. So we may start with one of our pre-departure meds like trazodone first and slowly wean them off over a 3 to 4 week period. Then once we get to our daily medications like Reconcile, we may do a 25% reduction every 4 4 weeks. And if at any point we see a recurrence in signs and symptoms, we're going to go ahead and bump them back up to the next effective level. But it also depends on the owner's desires. So back to little Charlie Champion, when he came in at I think it was the 2-year mark of my being there, a veterinary behaviorist, I was a resident at the time, I questioned them. I said, do you want to try and get Charlie off of medication? Because one of the things that we try and do as residents is to, for a good case report, we want to see if we can, if the training has actually taken place, the learning has actually taken place, and be able to get them off meds. And they literally looked me dead in the face and said, if you even suggest that one more time, we're reporting you to the board. And they were joking, but I said, all right, fine. We're not getting Charlie off of medication. And he is still to this day on meds and will be for the rest of his life. And that is okay. Our psychotropic meds are incredibly safe. The long-term safety of these meds is basically the best of pretty much any medication that we use on the market. So I feel very comfortable if owners don't want to get off of medication. So what about in light of COVID-19? The biggest question that I get from practitioners and owners in the media is, are we going to see an upswing in separation anxiety? And the problem is that we don't know. You've probably heard this a million times, but these are unprecedented times that we are in. Never before have we ever as a society left or been stuck in our houses for almost a year now with our pets. Many of these animals were actually, either purchased or adopted during this time frame. They may never have learned to actually be home alone. So I'm very worried about those types of dogs. The dogs that, were purchased as puppies and they weren't socialized to, the owners actually leave without me. The dogs that were rescues, and we have no idea what their backstory is anyway. And we do find a huge proportion of our patients with separation anxiety tend to be rescue dogs and cats. So are we going to see a big uptick? It's possible. So what can our clients and our owners be doing now? Well, first, they can start with the bond training. That is very simple things to do. They should be doing that in their general day-to-day life anyway. They should ideally be keeping predictable schedules and routines. So if they typically would work outside the home Monday through Friday from 9 to 5, they should still try and keep to that routine and work from 9 to 5. Now they can't necessarily work outside the home, but they can close a door. They can work in their guest bedroom like you see I'm doing here. They can be away from that pet in some way, shape, or form. If they used to have a dog walker come midday, they can still have the dog walker come midday. So they want to keep the pet to as much of that structure as possible. They can work on uncoupling those departure cues. So if they know that the dog keys off of them putting on their coat, they can work on a couple times a week putting on their coat and then sitting down and checking their email or getting on their Zoom call. And they should also be doing actual departures. And this is really hard to enforce to even my owners that have dogs with separation anxiety, that I'm doing annual rechecks right now. I'm like, you guys have to be practicing departures. There's nowhere to go. So I tell people, just go for a walk. Just go grab a coffee at the Starbucks, whatever the case may be. Go pick up your groceries instead of Instacart delivering them to your house. Make sure that you are actually practicing leaving this pet alone and then video monitoring them to make sure that we're not missing something. As in the earliest signs of separation anxiety, we want to make sure that they understand that they should seek care right away. Again, this is not going to go away on its own. It is not going to get better by just ignoring the problem and thinking, oh, they'll just habituate to me leaving Monday through Friday for 50, 60 hours a week. It's not how this works. And so we need to make sure that they understand that the earliest signs and symptoms, they need to be seeking care. They need to be ruling out medical concerns with their veterinarian and then seeking out, a veterinary behaviorist or certified separation anxiety trainer for help. Some other resources, Milena DiMartini is she is sort of the guru of the certified separation anxiety training. So she actually runs a course for dog trainers to become certified CSAT trainers. There is a great DogWise publication talking about kind of the next generation treatment protocols and practices. And that should be available anytime now. And it does have a chapter in there about medication. So this is for owners as well as veterinary professionals.